Welcome to FADA's virtual 2021 annual convention and exhibition. This session is Lessons Learned from COVID-19 and the Path Forward. Before we begin, we'd like to take a moment to review the logistics of today's webinar. All attendees' cameras and microphones will be muted throughout the event. We will be taking questions at the end of the presentation. At any time during the session, use the Q&A link in the toolbar to submit your questions. Please do not submit via chat, as we will not be monitoring this for audience questions. We are recording this session and we'll make it available on the Whova web and mobile apps afterwards. And as a reminder, the discussions in this session are not for media use. For quotes and more information, please contact FADA directly. Now I'd like to introduce Arlene Kahn, policy analyst at FADA, who will present the opening remarks.
Good afternoon, and thank you for joining us today. We hope this will be a lively discussion among our panel members, all three of whom have vast experience running housing authorities and have risen to the challenges faced by COVID, as have many of you listening in. We hope that we will have time for you to ask some questions or share comments and your experiences during this session at the end. But please join us for the campfire chat at 2:30 Eastern Time today, where you can better engage with our panelists and share your own experience from the past year, as well as your vision for the future. Our panelists today are Brian Gage, Executive Director, Akron Metropolitan Housing Authority in Ohio, Jean Reed, the Executive Director of the Abilene Housing Authority in Texas, and Brenda Westfall, Executive Director of the Ithaca Housing Authority in New York. Our panelists will reflect on what the COVID-19 pandemic has taught them about how they operate and how it will inform future operations and related decisions. This will include how they have continued to maintain operations throughout the pandemic and how in some cases they are preparing to bring back staff who have been working remotely from the office and other work locations. They will also touch on waivers they have adopted and how they have been handling core functions such as inspections and recertifications, including whether they will continue remote practices after the pandemic is behind us. In our preliminary discussions with these three directors, I found it interesting that while they were all addressing similar issues arising from COVID, their responses to these varied depending on what local factors played into the equation. And I'm sure many of you will find commonalities in their experiences. So let's get to it. We're going to begin with a brief 2-minute self-introduction from each panelist so you will know where they are from and how their area has been impacted by the pandemic. So under the convention of ladies before gentlemen, I'll begin with Brenda Westfall.
Good afternoon, Arlene, and thank you very much for that introduction. I hope everybody is finding themselves doing extremely well in their own communities now that we are 14 months post-COVID-19. As Arlene said, my name is Brenda Westfall. I'm the Executive Director at the Ithaca Housing Authority in Ithaca, New York. Ithaca is located in the Southern Tier region, approximately 1 hour from Syracuse, 2 hours from Rochester, 3 hours from Buffalo, and only 4 hours from New Rochelle, the city referred to as the COVID-19 epicenter. All of these areas are larger cities than Ithaca and were considered hotspots for a very long time. In addition to the larger cities that surround Ithaca, Ithaca is surrounded by adjoining counties, some as close as 30 minutes away, such as Broome County, Binghamton, New York, Cortland County, and Chemung County, Elmira, New York. Although Ithaca is close to all of these areas, we are a very progressive community that did very well adhering to the COVID-19 guidelines. Therefore, we have had a very low positivity rate considering we are home to two major colleges, both Cornell University and Ithaca College. Both colleges were in session in person through most of the COVID-19 pandemic and are still in person. Less than 0.5% of our population tested positive for COVID-19. Our county, Tompkins County, is made up of approximately 102,000 people, the city of Ithaca approximately 60,000, with nearly half of that number being our student population. This morning I checked our numbers, as I'm sure most do every day, and we have done for the past 14 months, posted on our health department website. Currently, we have 2 residents hospitalized and in our local hospital. We had only 6 new cases today, 52 active cases, which include those 6, and Tompkins County has experienced only 31 deaths.
Thank you, Brenda. And now I'd like to turn to Brian Gage.
Thanks, Arlene. My name is Brian Gage. I'm the Executive Director of the Akron Metropolitan Housing Authority. I've been the Executive Director here for almost 3 years now, taking over after our old friend Tony O'Leary retired a few years back. So Akron Metropolitan Housing Authority is a metropolitan housing authority. Population in the county here is about 500,000. We are just south of Cuyahoga County, which is the home to Cleveland Housing Authority. So in the Northeast Ohio area, also in the Secretary's former congressional district. So here we have 42 public housing developments, making up about 4,300 units and 5,100 vouchers that we administer throughout the county. So, and a combination of both public housing place-based and tenant-based programs here. We also operate a very robust early childhood initiative that has in-home contact with individuals, which was a challenge administering through COVID. We were kind of in Ohio, the big 3, Cleveland, Cincinnati, and Columbus were the hardest hit. And then we were kind of in the second tier, both population-wise, and as the kind of wave ran through Ohio for COVID, we were a little bit behind Cleveland, Cincinnati, and Columbus, but we eventually caught up with our population, catching it just as frequently as those in the urban areas. We were able to implement a lot of advanced corrective measures and solutions to focus on prevention and safety and security of our residents first, and employees first and residents second. And I will conclude with that, and we can get into the discussion after Jean gives us a little introduction here.
Great, thank you, Brian. And last but not least, Jean Reed.
All right, thank you, Arlene. As Arlene mentioned, my name is Jean Reed. I'm the Executive Director for the Abilene Housing Authority. I've been in this position about 13 years now. So Brian Gage and I kind of switched roles, right? Brian went from Texas to Ohio, and I went from Ohio to Texas. So the Abilene Housing Authority covers 20 counties. We're a little bit unusual for a housing authority, but we're sort of a urban or rural area housing authority. We're about 2.5 hours west of Fort Worth, Texas. Again, we service 20 counties. We have about 1,700 vouchers. We do 213 public housing units. We have a 48 unit tax credit property, and then a 170 unit open market apartment complex. For the city of Abilene, we're about 120,000 in population. So we were considered initially a minimal risk for COVID, but with an airport coming directly in from DFW, and we have American Airlines that flies direct on a daily basis, we quickly started to experience a lot of COVID-19 cases because of the explosion in the Dallas-Fort Worth area. So like many of the other directors, we've implemented a number of measures to make sure that we're conducting business in a safe way. And it's been our goal from the very onset to make sure that we're protecting our staff, we're protecting our participants, and we're also acting very socially responsible within the community. So as many others, we've seen our numbers spike. Thankfully, we are starting to see those numbers constrict here in the area. But again, Texas was one of those first states to really reopen its doors to conducting business and starting to remove masks and things like that. So we're really taking a conservative approach, and we're kind of slowly getting back to normal, ensuring that we don't move a little too fast so that the numbers continue to fall.
Great. Thank you, Jean, for that summary. Now we're going to move on to specific areas that each director had to address over the last year and we'll have to consider moving forward. And the first topic relates to how each director reacted to what was happening locally and or in each of their states and how they address local conditions at their agencies. So here I'll start with Brian. Would you like to begin and share your experience from Akron? Brian?
Sorry, I had to unmute myself
Oh,
there.
sorry. Okay.
I'm still learning this Zoom thing again. So,
That was
So,
your biggest challenge over the last
yes,
year,
yeah.
right?
so the initial reaction was to kind of assess the danger and the threat to the housing authority and our staff and everyone else. And the first relationship that we had to build was with Summit County Public Health. So we reached out to our public health partners and took their lead kind of on everything that we did, kind of mirrored after my experience down in Houston with FEMA and the city. When you enter into a disaster situation, you kind of try and look to the experts and look to those that are taking the lead. So that relationship and kind of following their lead and maintaining that line of communication between the people in charge was very important from the beginning.
No, sounds very challenging. So why don't we move to Brenda, who had a lot of difficulties in dealing with the many changes that came from her governor, and you'll find very interesting, I think. Brenda.
Thank you. Thank you, Arlene. So let me just start by saying that the size of the PHA, we have approximately 1,033 housing choice voucher families throughout Tompkins County, the city of Ithaca, and also into the county. 341 public housing, which is consisting of our senior units and also our family units. And 235 of that public housing is our senior units. And those are between two high rises, two towers. That area is also home to our administrative offices. So we were here and living through COVID-19 with our seniors is from the very early date of entering this. So, March of 2020, I want to say, is probably really when we started feeling the impact, and when we started feeling the impact of the governor's orders. So as the governor put out his guidelines through many executive orders, and sometimes more than one per day, we had to reinforce the guidelines by being flexible and willing to change for the betterment of the community and for the health and safety of our tenants and our staff. As a result of many of the governor's executive orders, we're required to create plans and procedures and to address everything from hazard mitigation to reopening, returning to work guidelines. And then finally, as recent as April of 2021, all public agencies were required to put together a public health emergency operation plan to address any future pandemics, and really the pandemic that we're still in. So while we were trying to follow what was going on locally and in constant communication with our health department and what updates were coming out of their daily, the governor had updates daily. The governor had many executive orders, and all of these had to be communicated to thousands of people. Instead of being reactive, we had to be proactive by monitoring the ever-changing and sometimes daily guidelines set forth by many and by the World Health Organization, the CDC, our local health department, and also looking for outbreaks and what was going on in communities close to us. We're constantly looking at what might be coming our way. I stayed in touch with other executive directors from New York State, neighboring housing authorities, neighboring communities, but also in places like Syracuse, Buffalo, and New Rochelle. Because again, we all knew what was going on in New Rochelle, and only 4 hours down the road with a daily bus running from Ithaca to New York City, at any moment, we could have become that epicenter. As a result of the guidelines were received and the executive orders and the creation of plans, we started to put all that in motion. We closed to the general public, but the staff were still here working on site every day. We immediately deployed maintenance to begin focusing on all of their time on deep cleaning and sanitation of all of the common areas and all of our buildings, while we watched most other human service agencies, including our own city offices, close their doors, furlough staff, and remote work. We felt that we had a moral obligation to do everything possible to keep the deadly virus out of our buildings, especially our senior high rises, which again is also the location of our administration offices. And we thought that we could do that in a safe manner for both our tenants and our staff. So while doing that every day, you had to have eyes in various different places, because although that was the plan at that moment, I was very much aware that plan could change in 10 minutes or 30 minutes or the next day. We're constantly providing information and communication to our tenants through memos and posting updates on our website and bulletin boards throughout our building. Unpopular decisions of closing our common rooms were made, including our community rooms and activity rooms, and our congregate meal site was necessary, that it really needed to be closed. We had to go as far as removing furniture from lobbies and sitting areas to ensure that social distancing was being adhered to. Again, finding ways to communicate this to so many people at one time was not easy. We reached out to our phone service to see how we could get robocalls out there, because I thought if the schools can do this, we can do this. And I found out that I was somewhere near the bottom of the priority chain in being able to make this happen. As of today, we still can't do robocalls, but struggles of learning how to communicate, and especially with large groups of people, were a challenge for us. And trying to help our tenant population when the other human service agencies that they depended on just were not there, were also a challenge. So it also really took a toll on the communication.
Thank you, Brenda. There's quite a few challenges for you, it sounds. And lastly, from Gene, who had to look at policies of his that were different from his city leadership, and also may discuss mask mandates and how these continue to be a challenge during reopening. Gene?
Right. Okay. Thank you, Arlene. So, as I mentioned earlier, the city really considered Abilene as a minimal risk because we are 2.5 hours west of the Dallas-Fort Worth area. We're probably about 2.5 hours away from the nearest city, major city in any direction. So, one of the things that we really had to fight with is, what is the rest of the community doing versus what the Abilene Housing Authority is doing? And here's sort of what we did. We took a very conservative approach. Initially in February, March timeframe, when we started to see a lot of those COVID-19 cases hit the West Coast, we sat down with the staff and we started talking through what are some of our plans or plans of action in case this continues to migrate across the country. So I come from a emergency response background, 10 years with the gas and electric utility industry, running the emergency response department. So we initially put our plans together in front of where most cities were. Quite frankly, we were quite a ways in front of the city of Abilene. So that March timeframe, we started closing our doors to the public because of the spread of COVID across the country. It didn't take long, probably about a week or two after we closed our doors to the public, that we started seeing some of the first cases in Abilene. So obviously we had a lot of phone calls about why we were shutting down. We had a number of calls that said, hey, the city's not shutting down, other entities aren't shutting down. But again, we really wanted to take a conservative approach and make sure that we kept our staff safe. We wanted to make sure our participants and residents were safe. And we wanted to make sure that the community stayed safe. So very much like Brenda and Brian, we went on a major campaign to communicate with a lot of the community, with a lot of our participants. We utilize our website to communicate with the public, to let them know what we were doing. We put signs on the front door to let them know what we were doing. But really, I thought one of the promising things or things that I really like about housing authorities in Texas is about the same time we were planning, most of the other housing authorities around the state were planning as well. So we reached out and started communicating with some of the other executive directors and CEOs from around the state, really came up with a lot of best practices, shared a lot of standard operating procedures that we were putting in place to really strengthen what we had and help strengthen what the other housing authorities had as well. And really came up with a pretty robust plan that we started sharing with housing authorities across the country. So again, very challenging times when you're kind of going against what the establishment there in the city is butting hit or going against. We had to answer a lot of questions initially, but overall, I think a lot of the community started to do a lot of the same things that we were doing in terms of shutting down to the public and starting to send individuals home and starting to work remote. So.
It's great that you are the leaders for your community, and because Jean, you've hit on some of the our next topic, which is really communicating with residents, participants, staff, and health officials to keep operations going. I'll stay with you. And is there anything else you want to add to the communication discussion? I know in our pre-interviews, I thought one of the interesting things that you mentioned was the YouTube videos you produced for eligibility and some of the discussions we had about hotspots and Wi-Fi. I don't, if you could touch on some of those, that would be great.
Exactly. So as we sat down with leadership at the Abilene Housing Authority, we started talking about operations and how will we move operations forward in an environment where we can't go directly to the participants that we normally worked with face to face. So what we knew is that we had to continue to do some things, and we had to do some of the emergency items that may come up. But some of the items that weren't an emergency item, we were going to kind of set to the side and start to use other technology to do some of those things. So like you mentioned, Arlene, we have a YouTube video. If anyone wants to go to the Abilene Housing Authority website, you can take a look at our public housing YouTube video for briefings, and you can also look at our Housing Choice Voucher YouTube video for briefings. So we wanted to try and keep things moving slowly. We knew we weren't going to be able to do it as quickly as we used to because it was some new processes that we were putting in place. But we were able to get those out there. And, a lot of what we learned is that, our participants really liked that because they could work through that at their own speed. So if they wanted to back up and rehear something they didn't catch initially, they had the opportunity to do that. So, YouTube was a very good tool that we used. We also started to utilize some spare iPads that we had laying around, right? So we had a few spare iPads, and even before HUD put out the waivers, we had talked through how are we going to do inspections, right? We were not going to send our inspector indoors. So we, and actually it was one of my HCV managers that came up with the idea of, hey, why don't we use those extra iPads and we'll connect through Zoom and we'll provide that participant with one and they can walk through and show us all the different things that we need to inspect, and we'll just do it virtually, right? And just a month or so later, HUD kind of came out with sort of the same thing. So, we've really been using technology to assist as much as we possibly can. Even within our front lobbies, we bought it's a temperature measuring kiosk that is, you don't have to have a person standing there actually taking the temperature, right? So, you know, what we wanted to make sure is that we did have a few staff members coming into the office, that we were doing it as safely as possible. So we were able to purchase this kiosk from Tidal, where it's mounted on a stand, and all you have to do is stand in front of it, and it actually gave you a temperature reading. So it would relay it back to a computer. We put in new policies and processes where staff knew if they had an elevated temperature, they weren't allowed to come in. They could retest in about 15 minutes if they thought the external environment caused their temperature to be excessive. But again, we've utilized a lot of technology. We'd like to continue to utilize some of that as we move forward. But, you know, the silver lining in this whole thing is, you know, I think there are going to be some things that we utilize moving forward that are really beneficial to not only our program, but for programs across the country.
Great, thank you, Jean. And Brian, you had some high-tech responses in terms of your Wi-Fi that you talked to us about in your hotspots, but I also thought it was interesting that you had some low-tech things with your paper drop box and some of the things you were doing in your lobbies. Maybe you could talk about some of those.
Yeah, our main office here was built before 9/11, and so it was not designed really with the security level that was necessary post 9/11, and we actually had started looking at some design modifications of the building and our client interaction space, both the atrium and the lobby, and how to increase security in our building as it was. When the pandemic hit, it kind of allowed us to fast track it. And when the CARES Act money came, it really allowed us to fast track it, the modification. So we ramped up a couple of things. One was we were an early adopter of a plasma air ionization system that we installed throughout not only our workplace here in our main office, but we were able to get it installed at all of our senior buildings. So for all the common areas and everything else, we installed those immediately within, say, the first 90 to 120 days after the pandemic. So after it started, to make sure that everyone had clean air. And it's very interesting because we had a clean air health initiative anyway. And this was something that came to light that kind of aligned with our agency mission and vision for clean air. So we did that right off of the bat. And then, you know, we were able to buy them before everyone else bought them. So we had them in inventory and was able to install them. But yeah, we were closing our lobby to do the renovations. So we had to figure out how to work with that. So the first thing was just a Dropbox. We put a mailbox out front for people to drop off forms in because they would no longer be able to bring them in. But what we realized was our recertification specialists and our intake, they started working with people that had cell phones. Everyone's got a cell phone out there. All of our low-income families have cell phones. And so instead of, you know, bringing in a social security card, waiting in line, getting a photocopy, grabbing that copy, shoving it in a file and meeting with your caseworker, which could take an hour to an hour and a half, we were able to kind of text back and forth or scan and email documents. And it saved our staff quite a bit of time that they didn't have to meet in person to get this piece of paper. So that was an efficiency that we're definitely keeping for the long term and trying to integrate that into our operating practices when we open our front lobby, probably within the next 30 days or so.
Great. And Brenda, you did mention some of your challenges with robocalls already, which is part of our communications, but in our pre-interviews, you talked about how your ability and methods for communicating with residents and the health department and some of the need to be paperless. Can you talk a little bit about some of those challenges you had?
Sure. So, you know, recently I talked about all of the plans that we were required to write due to the governor's orders, and then we had to communicate those plans, right? So we had to communicate them to all the staff, make sure everybody was on the same page, communicate those to the tenants as well, and what procedures were going to be put into place. So most of the communications with the tenant were done through memos, which was very labor intensive. That was the quick realization that we needed a better way. In the beginning, the information, the guidelines changed frequently, sometimes more than once a day, like I said. There were also notices posted throughout the buildings, bulletin boards, common areas, as well as our website. We instructed tenants and participants to call or use email as the preferred method of communication. And we found that they did it and they liked it better, similar to what Brian was saying. We also have drop boxes throughout our senior buildings and a Dropbox location where the families could come to the senior building and not actually get in the senior building, but they could access that Dropbox. So they're coming into a vestibule. We had applications available there for people to fill out and put them in the Dropbox or drop off their recertification paperwork, rent checks, or any paper communication that they needed to get to their caseworker. And that worked really well. We asked the seniors in the senior building, we suggested them to limit the flow of traffic by reducing their come-ins and their goings and reducing visitors. We didn't close off the buildings to the public, but we did ask them to reduce it, and they complied with that. The voucher pre-screenings and the voucher issuances and the briefings were conducted through mail. And we were able to load onto our website a video for them to watch and then sign a certification that they did watch the video. In terms of our nurse case manager program that we have in the building, it's actually a program that we created years ago. And it's a platform to help the seniors live independently for a longer period of time. Through past years, we expanded that program. And then through our partnership with Visiting Nurse Services, they were able to get that program funded by Care Compass Networks. So we have 2 full-time registered nurses and an LPN in the building that work with a lot of our senior populations, and having them here and working with our seniors really helped us a lot through this process, because they were also able to provide communication to our seniors. And our seniors were more so on our radar because we were able to then know what was going on with them and what their needs were as well. We do a monthly food distribution in our senior buildings, and obviously we could not do that the old way. We couldn't bring 250 people down to go through a food pantry line. So we were using our internal resources to actually deliver food to the seniors. And the communication of who needed food, who didn't need food, was really working through our staff, through the nurses, and also through our ROS coordinator to get the tenants what it was they needed during that period of time. So again, if we had the ability to be paperless, we would have been more efficient in our process. I feel like we were efficient and we still got the job done. We met the demands of our participants and our tenants. Being closed to the public helped us become more efficient, and having staff that preferred to be on site working versus working remotely also helped us in that ability to be efficient. I was in constant contact with our local health department, pleading for vaccines for especially our vulnerable population once the vaccines did become available. It was a little disheartening in the beginning because, as we all know, vaccines were targeted for specific populations, mostly healthcare workers, and Ithaca was really no different. I ended up reaching out to the governor's office, pleading for vaccines and requesting a pop-up clinic inside of our senior facility. Although we didn't get the pop-up inside of our senior facility, what the county received was a designation of vaccines specific for the vulnerable population inside of Titus Towers, inside of the Ithaca Housing Authority. And working together with the health department and the local transportation providers in Tompkins County, we were able to register and get about 160 seniors to a vaccination site. And by the end of March, they were fully vaccinated, as were 5 of our staff And then as the vaccines started to open up, we used our RUS coordinator and staff to help get additional tenants registered to get them vaccinated as well.
That's great. Thank you, Brenda. Very
And,
helpful.
and
Yes.
Arlene, can I jump back in there real quickly? You had asked me a little bit about the school system
Yes.
and the hot spotting. So just real quickly, as we started shutting down and the rest of the community started shutting down, one of the things I was really impressed with the city of Abilene is, everybody started reaching out to everybody else. So, I'd like to say we thought of everything, but we didn't. But as the community started thinking about things, the Abilene ISD reached out to us because they were sending kids home remotely. We worked with them at one of our public housing sites to set up some hotspot technology so that those kids at that specific site had the ability to go online and to complete their assignments as needed. So I just want to jump back in and state that for you as well.
Yeah, that's really important. And
Arlene, do you mind if I stick
not at
there
all.
too? Since
Go right ahead.
since we brought up the issue too, the Wi-Fi was really helpful for us too, because we did run the early childhood program, which was a home visitation program. So we did have the hotspots that were available, and we were able to transition one of those resident services that we offer through a grant funded program, and transition that into, instead of it being in home, we did it virtual by providing hotspots and some other technology. Plus, I think the pandemic really brought out a realization, especially later on, that the kids needed it for school, that seniors needed it for their health visits, and that people needed it to go to work, essentially during the pandemic. So we found a lot of foundation money, and a lot of cities were getting some of their CARES Act money, and they were very willing to make investments in the technology and Wi-Fi for that. So as a result of this, we were actually able to get secure funding to go 100% Wi-Fi for all of our in-units at 4 of our developments, through either philanthropic partnerships or through some CARES Act money that was given to us by the city. But people definitely started opening up their pockets for internet connectivity kind of as this went on. So if there's a silver lining to that, I think that would be one of them, increased connectivity.
Oh, thank you, Ryan. I do think these topics overlap, and it's good to kind of talk about what you want to talk about when we're on that subject. And I do think the next 2 subjects actually kind of flow together. And so if you want to talk about them simultaneously in each of your presentations, feel free to do that. The first has to do with inspections and maintenance and how you kept that going. And that's probably the area that FADA has interacted most regularly with HUD, and where we get the most member concern, particularly on restarting inspections. And we know we now have virtual inspections, and many agencies wonder who's using those. So if any of you are, you should talk about that. But finally, how this all relates to, and you can expand on the remote work aspect, and whether or not you're looking at, well, you'll all have challenges in terms of staff who have young children at home, and some of you will put policies in place to ensure responsiveness on the part of employees, and whether you'll continue to allow remote work even after the pandemic, because you feel that it does work for your staff and for residents too, as some of you have mentioned. So why don't we go back to Brenda to start on this one?
Okay, so for the inspections and the maintenance, during the beginning of COVID-19, I'm going to call that March 2020 till about maybe September or October, I just kept maintenance focusing on cleaning, sanitizing, emergency work orders, and rehabbing vacant apartments. We're only going in apartments that were occupied by tenants if it was absolutely necessary. We were asking them to make sure that they were utilizing PPE. The maintenance staff were required to ask a series of questions before entering. The individual taking the work order would also ask a series of questions before deploying the maintenance worker to that unit. Again, just trying to use universal precautions across the board. Annual inspections of public housing and HCV properties pretty much stopped in March And we started them back up again, I would say July or August of 2020. We started to see the numbers in the community get better. Again, it was daily looking at the numbers, which you could literally drive yourself crazy with. It became my mission in life. I felt like I was obsessed with the health department app to look at what was going on with the numbers. The app reported one thing, the local news reported something else. And again, in the evening, you're watching the news in Syracuse and Elmira to see what's going on around you. And I think sometimes always, did I make the right call? That was something that I think weighed heavily throughout the entire pandemic, especially during the early parts of the pandemic. But even with starting the annual inspections again in July, August 2020, we received very minimal resistance from both our public housing tenants and also our Section 8 participants. And we were very honest and upfront. We said based on the numbers in the community, we feel very safe. If you're not at all comfortable with doing this, we're happy to schedule you at a later date. And we kept track of that. What we didn't want to do is go an entire year of not inspecting properties. And although there were waivers out there that were available to us, and we did write those waivers into our admin plan and our ACOP, it was really as a safety barrier for us in case we really needed to utilize them. One of the things that we have talked about is maybe biannual inspections in the future, something to, again, just make the process a little more efficient and the flow of work a little easier. One of the things that we didn't really think about when we were catching up those inspections that we didn't do in March, April, May, and June, and we started doing them in July, August, and September, is that those are already our heavy months for especially the Section 8 program. So now we're into 2021, we made those months even heavier. So now we're looking at processes to thin those out into the future, whether that be with biannual or maybe inspecting again, so that we have more consistency in numbers throughout the year, so that we don't have 180 recertifications in July of 2022 like we're looking at in July of 2021. It's a lot. In terms of remote work, again, since this wasn't a past practice, we had to create a telecommuting agreement. We had to talk to the staff that were asking to remote work. Again, I said out of my staff of about 25, only 3 asked to remote work. 2 of them were FSS caseworkers. It was very easy to convert them over to remote work. One was a Section 8 caseworker. And again, we accommodated that individual by having staff in the office, and they would scan in the documents that they would need in order to complete whatever transaction they're working on, whether it be a recertification or a new issuance of putting a new family on the program, or a rent adjustment, which I'm sure, like all agencies, we did hundreds of them. The documents would get scanned in by somebody in the office. It would get uploaded to a file. The caseworker would retrieve it, complete that transaction, send a email back to the staff in the office. All the documents would be printed off, because we're very paper, and put in the file and mailed out to the participant. It wasn't the most efficient way to do it, but it got the job done when you don't work in a paperless world. And when you have to adhere to that folder, absolutely cannot leave the agency. So there was no paper that left the agency. That was not an option, but we still had to get the work done. So we put agreements in place. Everybody were provided laptops, which we purchased with CARES Act money. Prior to that, we may have had 1 or 2 laptops in the agency, but not many laptops. We now have enough laptops where if we had to shut down tomorrow, and again, it's not the best system, but a system in place where as long as you have a laptop and a telephone, and we can at least have a couple of staff in the office, you can still get the job done.
Great. That's fantastic. Thank you. And Jean, I think you put virtual inspections into place, and you also talked to us about how iPads and laptop purchases helped with some of the remote aspects of the work. If you'd like to talk a little bit about those.
Yeah, exactly. So for us, all of our management staff had laptops initially. There were a few of the staff level folks that had laptops. So traditionally, we've kind of given that choice to our employees. Would you rather have a desktop or a laptop? So for those individuals, once we started to go remote that didn't have laptops, just like Brenda, we utilized those CARES funds to buy additional laptops so that individuals could work remotely from home. So we also had to work with our IT group to make sure that individuals had access to all the files. So your shared files, your personal files, and all of those things. We had to make sure that we had that connectivity for folks to be able to access that from home as well. So laptops were great. You know, as we start to move forward, you know, times where individuals have to be at home, you know, they definitely have the opportunity to be able to utilize those devices during those times as well. As for remote and where we go from here, we're still not sure yet. Remote does bring some challenges, right, in terms of being able to manage staff and making sure we're as productive as we possibly can be. But we are kind of looking at that and how we might integrate that into our long-term plan here at the agency. So yeah, so that one's still up in the air. So, you know, what does it look like as we start to return back to work? So probably many of you guys across the country and on the panel, we have come up with plans to actually do some remodeling of our front lobbies at our public housing and our housing choice voucher offices. It has taken us a while to be able to get a contractor. As things started to shut down, contractors took off, right? So a lot of the work that they were doing across the country and throughout Abilene was tremendous. I mean, from roads to new homes being built, the whole 9 yards. So they've been really active. So it's been a difficult challenge for us to be able to get those contractors in place. But we finally have one. We're getting started on some of those renovations in the lobby. As soon as we get those renovations into place, and if our numbers continue to downward trend as they are right now, we'll be looking at bringing individuals back to the office pretty much full time and then opening up to the public. But, you know, one of the important things that we want to make sure that all of our employees have an opportunity to do is to make plans for their children, right? And that was one of the reasons that we actually sent folks home remotely, because again, as we started to shut down and as we went remote, the school systems were doing the same thing. So for those individuals that had kids that were 2, 3, 4, and 5 years old, that couldn't be left home by themselves, that couldn't go over to grandma's house for babysitting, again, by us going remote as well, allowed them to take care of their kids. So as we start to go back, we're going to give a 2-week notice to our employees that we're planning on coming back so they can start to get those affairs in order with daycare and things like that. And then we'll actually bring employees back to start working as normal in our new normal environment.
Sounds great. Thank you very much, Jean. And lastly, Brian, you want to talk about how you addressed your maintenance issues in Akron, and also what your thoughts are about how remote work worked for you or didn't work for you.
Right. No, there's a couple of things that we learned kind of right off of the bat. So the first thing that we did kind of when this hit in was we implemented kind of this liberal leave policy, right? Where people could use sick time for non-sick things and regular leave whenever they needed, because we knew there was a challenge with childcare, with working, but we also moved to a remote workforce also. And we did that very quickly, right? We had these mobile computer labs that we had set up with like 26 laptops in each one. And they were for, events that we'd hold, and we'd go and to do, resident training on computers. But we were able to mobilize those right away to give to staff, to move them from the office to home, as well as give them, printers, scanners, whatever they needed to start working from home. The challenge was when we had to take that stuff back, right? Everyone got used to us giving out everything you needed to work from home. And then all of a sudden we're bringing it back. But there was a challenge with maintenance, right? Because they could not work from home. So, it's really one of the few jobs that really involves you to be in the office every day. So we were able to modify our shifts, and we're in a union environment here. So we were able to modify quickly the collective bargaining agreement with the authorization from my board, which essentially passed a resolution that allowed me to do anything in my power to mitigate the damages of COVID, which, by the way, if this ever happens again, that's a great resolution to get. You can implement things kind of on a minute's notice rather than having to wait for a board meeting or call an emergency board meeting. So we modified the collective bargaining agreement kind of on the fly to ensure social distancing, and that we had longer days for the maintenance, but shorter number of days, less overlap with the maintenance. So it was more challenging working with them on social distancing and making sure that they were safe. But one warning that I will put out there relative to, we rolled out this remote work very quickly, and people were using a VPN to get into the office. And as kind of things mounted through this whole pandemic, there's been a spike in increase in cyber crimes that are out there. And this did leave us vulnerable by going out. So we did suffer a ransomware attack in January of this year because our security level wasn't high enough on some of our remote connections. We've now remediated that, but we were down for 3 weeks to a month rebuilding our entire network because of that. So I think one huge lesson that we learned about going remote and going virtual with a lot of this is, the cyber threats that are out there are only increasing. They're not getting any less. And cyber crimes are going to become more and more frequent. So that is something to protect against, to secure yourself against, and make sure that you have very high levels of security and access into your systems.
Great, thank you.
Yeah,
Brian.
and I just want to comment on that, and I think that's really important, Brian. I'm glad you brought up that topic of ransomware and things like that. So for housing authorities out there, I would suggest that you contact your insurance carriers. We just added increased insurance to protect against cyber attacks and things like that. So that is a new type of insurance that's being offered by a lot of your insurance carriers, and it's probably something that each housing authority really wants to look at it in these days.
Great, thank you. And Brian, there's a question if you could post the resolution document that allows the EG to mitigate any issues related to COVID-19, or send the link where it's posted on your website. And if you could put it in chat, if not, you can send it to us after and we'll send it to the person.
I'll send it to you, but there was actually 2 companion resolutions. One was the golden ticket that allowed me to do everything. And then the second one I affectionately call my death resolution.
Okay.
And that one was more somber, but it was, if I succumb to COVID, what would be the succession planning? And it went down kind of the list of who would take over.
Yeah, important to consider. Now, this question could take a whole hour, so try to be, short with your answers. We're at our last 5 minutes. How were your CARES Act funds spent? And you want to start with Jean?
Yeah, just real quickly, the majority of our CARES fund was to reorganize the front lobbies in a very safe way. We also spent a lot of those CARES Act dollars purchasing some laptops. We also, used some of it to pay for time where employees did get sick and they had to take off. So those are some of the really big items that we utilize those CARES Fund Act for, and we've spent pretty much all of those funds at this point.
Great. Brenda?
Yes, so similar to Jean, like I said, we didn't have laptops. We needed some IT to get us up and running. CARES Act was used for that. We ordered numerous laptops. We used it for staff salaries. We used it for staff who couldn't come to work because of a COVID-related issue, or in the beginning of COVID, really any family member, if they couldn't come to work per the governor's orders. We used it for cleaning supplies. We used it for OT, overtime, a lot of cleaning supplies we purchased. Like I said, part of the public health emergency operation plan, I'm happy to share any of these plans as well with anybody who's interested. It talks about how we're gonna, similar to what Brian says, how we're gonna keep running if we can't come to work, who's essential and who's not essential. And there was one more thing we used it for, and it escaped my mind, sorry, but I said overtime. We used it for hazard pay. The board passed a resolution. The staff were here every day on the job. We didn't close for a minute, let alone a day. So the board, based on the level of hazard that each employee experienced, passed a resolution and provided hazard pay to the staff.
Great. Thank you, Brenda. And Brian?
Real quick, I think the major things that we spent it on, one that I didn't mention was a paperless conversion. So we implemented to go fully paperless. That was something, again, we had that in the hopper, but we were slow playing it, right? And all of a sudden this funding coming available allowed us to fast track the conversion over to paperless. Also our lobby modifications. And then we did a lot for operations. And a lot of that's what Brenda said, overtime, supplies, those sort of things. And we moved a lot into operations to make sure that we had it all drawn down by December. So we have spent all of it and pulled it all out.
Great, thank you. Now, you've all done such a great job keeping in our time frame. So this is our lightning round. In less than 1 minute, each of you has to share the biggest lesson you took from the pandemic and one idea, practice, or innovation that you're keeping. And I'll start with Jean.
Okay, so we really fell in love with the virtual inspections. I mean, I think that adds so much to productivity. It's an ease of use. Our participants actually like it. Our landlords like it. Some of our staff really like it. So one of the things we're definitely going to keep is that virtual inspection.
Perfect. Thank you, Brian.
I'm going to say the one thing we learned and weren't prepared for is having PPE, masks, and hand sanitizer. For the first month, we were fighting all over the place to get that, right? So keeping an inventory of that, I think, is very important to be prepared and a small stockpile of it for the next time, for the next pandemic. I don't think this is the last time. And I think a lot of the innovations, the biggest thing we learned from this is a lot of the innovations on just like communicating with our residents via texting and email and cell phones. We were so reliant on paper and people coming in for face-to-face meetings that we're benefiting from that. And thirdly, we were very, very afraid of flex time and letting people work from home. And we learned that the place didn't collapse when we did that. So we're keeping that too.
Fantastic. And Brenda, you have 1 minute to tell us your answer.
Okay. That's hard because there were so many things, right? But like Brian said, you figured out how to run your operation better. You thought you were good, and this made you realize that you weren't that great yet, right? Then you could be greater, and you could be more efficient. And we learned that just by changing things, we became more efficient. So closing down the lobby, closing down the administrative offices to the public, we became more efficient. They became more responsible. It was a beautiful marriage, right? So we're going to keep that. We probably will not open every day from 8 to 4:30 for clients to walk in, fill out applications whenever they want. Moving forward, or seriously thinking about having lobby hours, maybe 2 or 3 days a week for specific periods of time. And through this time, I think that the tenants and the participants figured out how to communicate with us through other measures that they won't want to come to our lobby and meet in person anymore. The caseworkers became far more efficient and less stressed. So stress levels actually decreased during a time when it was very stressful. And the other thing we'll certainly be doing, like Brian, obviously not as fast as he did, but figure out a way to go paperless quickly.
Okay, great. Thank you, Brenda. Thank you all three. And I'm sorry, we have to cut it now back to Blake, but join us back at 2:30 for some more great discussion with the panelists. Thank you.
Thank you all very much. And as Arlene said, we will be having the campfire chat in just a half an hour. For now, though, this concludes this session, and we would like to thank all of you for attending. We'd also like to remind everyone that a recording of this session will be available shortly on the Whova web and mobile app. So we'll now take this half-hour break before the next session, during which, please feel free to stretch, grab some coffee, network with fellow attendees in the Whova mobile and conference app, as well as visit the virtual exhibition hall. And we'll see you all back here at 2:30. Thanks very much.